Hey, it's Chris from ROE Dental Laboratory, and today we are talking full arch restorative workflows. There's a couple different workflows we're going to discuss. One's a digital workflow that kind of brings it back into the analog world, but there's some advantages obviously with the digital portion of that. And then we have a full analog workflow over here for the full arch transition into your printed Trion and your final zirconia. So on the right here, completely analog protocol. So patient full arch surgery is done, implants are integrated, and now we need to transition into their printed Trion or their wax Trion, and then ultimately their zirconia final. But we need to establish a vertical, and we need to establish passivity of the implant. So usually it's down to about 3 appointments for this. So the first appointment, you're going to send us the upper, lower, and a bite, depending on if they're wearing a immediate load prosthetic or not. But we need upper and lower impressions. And then the next appointment is going to be a longer appointment. We're going to send you back a screw down bite rim, screw down bite block. And obviously we're going to establish vertical with this, and then we're going to put our markings in here, our center midline, cuspid lines, a high smile line in here. Give us some notches for a bite. And then we will also send you a fit verification jig. So initially you screw this in, get your vertical, make your marks, unscrew that. Then you're going to screw the verification jig in, and we are going to assure passivity here. So if it's not passive, then you are going to section it at the area where it's not passive, and then relute that together, and then you'll send these records to us. And from here, we're going to make a printed Trion, which is a prototype for the final. But this appointment can be long and tedious for you and the patient because you're doing a lot of screwing and unscrewing of these different devices in the mouth. So let's go over to this side. This is one of our digital workflows. We have a couple different digital workflows that transition into your final, but this is called the iJIG. And the way it works is the patient is wearing their immediate load prosthetic. So I don't have that here with me, but we'll kind of see the workflows following that. So at the initial appointment for the immediate load prosthetic, we want you to unscrew the prosthetic they're wearing and then take a tissue scan. So scan the healed tissue, because we want to make something that's nice and convex, and again, a prototype for the final. Scan the healed tissue, and then you're going to take a 360 scan of their prosthetic. We're going to send you some analogs, some scan analogs. You're going to screw them into the intaglio of the prosthesis, right into the temp cylinders. Screw those in, then you take a 360-degree scan of the prosthesis. Next, you will unscrew the multi-unit abutment analogs, or the scan analogs, reseat the prosthetic, screw it down, scan the opposing, scan the bite. From there, that you're done at that appointment. Next appointment is going to be the iJIG seating appointment. So from there, we fabricate the iJIG. And what it is, it's a fit verification jig and the bite rim all in one. And it's a duplicate of the prosthetic they're wearing, but it's more idealized because now we have it meeting the tissue. So this is actually a prototype of your final. The iJIG already comes sectioned for you. So what you're going to do is remove the immediate load prosthetic that they're wearing, seat your iJIG, and screw each section in. Prior to doing that, you might want we want a tissue reline. So you can either scan the healed tissue, or you can put some tray adhesive on the intaglio and to express some PVS in between the intaglio and the tissue to capture the healed tissue again if it needs to be captured. Ideally, we're meeting the tissue perfectly with the iJIG. Once it's seated, you want to make sure all the sections are passive, and then lute each section together. Give us dial in the bite, because that's what's nice about the iJIG. It's your screw down bite block and your fit verification jig all in one. So it's replacing these two things all in one. So you're only screwing and unscrewing one thing. Screw it down, take your bite, reline impression if needed, give us an opposing, send that back to us. From there, we are going to make a printed Trion. So this is kind of what a luted together iJIG looks like. We have a reline impression. The sections are luted together. We have a bite. We have opposing. Send it back to us. We're going to go to a printed Trion. And then into a final. One thing you can do to speed this process up here is, it's called the iJIG Plus. So we can avoid the sectioned verification JIG appointment, the iJIG appointment, if you, at the scanning appointment, the initial scanning appointment at the records, you go ahead and take your scans I discussed, and then take the immediate load prosthetic, pop some analogs in that, set it in stone, pour up a model. So now we can make this verification jig to that model. So now we have a passive model, we know it's verified, we can make the jig to it, no need to send it sectioned. So now you're going right to your printed try-in, and then you can get to your final faster. So again, another advantage of the digital workflow, comes back into the analog world, but overall, it can be a lot faster, especially if you pour that model with the iJIG Plus protocol. Any questions on either our digital workflow or the traditional analog workflow, leave them in the comment section below. You can always check us out at our website. We have an iJIG section, we have an iJIG Plus section for all the records, and then if you could, please subscribe to our YouTube channel. Thank you.